everybody. My first words goes to all the students that we have here in the room. It's fantastic that on a Friday afternoon, instead of drinking Jolas somewhere, you are all here to listen to all these startups. In my school days, there were no startups. So this shows the difference that we have now in our country. And the potential entrepreneurs that we have among us. So good sign for each day. Anyhow, let's move forward. Let me tell you that physical therapy costs per year 24 billion US dollars just in the United States, 30 billion euros in Europe. And it's estimated that these costs are growing 7% per year, at least till 2018. Large part of these costs are funded by insurance companies, and for them, in a very inefficient process. We at Kinetikos have digged into this and found a way to cut these costs by 20%. I'm Luís Rodrigues, I'm one of the co-founders of Kinetikos, together with Ricardo, that is sitting over there, and another folk is in Cut Valley, and I would like to tell you how we can contribute to this cost reduction. Let me show you the process. Imagine you hurt your knee while jogging. Everybody is jogging nowadays, right? You hurt your knee and you went to see a physician. What kind of information does it has about you, about your previous self, about other patients with similar conditions? In reality, there are a few things we know about their practice. Normally, they do not, in a systematic way, collect information about what they do on a daily basis. They make the diagnosis based on observation. That left alone is not accurate enough to quantify the movement dysfunctions. And they would like to have more tools, or at least tools that could help them improve the patient outcomes. As they struggle to combine all these multidimensional data that they collect from the patients and transform these into actionable info, they end up deciding the treatment based on their experience. And then, when you have an insurance company involved in the process, then they matched everything against actuarial tables that are based on fine statistics, but are a result of a practice that is a bit outdated, just based on observation. We at Kinetikos proposed a much better way. In fact, this is happening because, as you can see, the healthcare systems rewards quantity instead of quality. So what we have done, we have designed a decision support system and put it in the cloud. Any clinician using a tablet, a laptop, a computer, a very intuitive web interface and an internet connection can upload information to our decision support system. Any physician can combine clinical and motor information about their patients to collect as much rich information as possible about the individual they have in front of them. To collect the motor information, it's very easy by using sensors, as you can see. When the information reaches our decision support system, our biomechanical models, our machine learning algorithms recognize the patterns and produce a report. And this report, as you may see, describes the dysfunction, can classify the degree of disability or the severity of the dysfunction, and estimate the time for discharge. Or in other words, the expected weeks of treatment that is a result of the best scientific evidence available. Okay. Now imagine that we can spread this decision support system among the health providers and the insurance companies. Then we can create a common ground of communication between them, of clarity. And the health providers can use the actionable info to open new services, to increase their revenues, but most likely to increase the patient outcomes, which is something they are looking for. At the same time, the insurance companies can well in advance predict or estimate the costs that are going to have in any claim and look and follow up and control the costs during the treatment. Okay? As you may figured out already, we address the insurance companies and the health providers as market segments because, together with the patient, the third pillar in the rehabilitation model, They are the ones, most of the case, acting together during the rehabilitation phase. And we serve them in a B2B model and ask them for a recurrent annual fee for access to our services. Our company is a young startup with 3 co-founders, bridge Lisbon and Silicon Valley. We have 2 decades among us of experience in multinational organizations, management experience, and award scientific production in mobility disorders. What have we done so far? What milestones we have achieved? During the first year of the company, we built a company after 10 years of research among some of the co-founders. We built a company, and during this first period, we made a proof of concept with real customers, nearly 250, in a real clinical environment, and we were able to demonstrate that we can save or increase the effectiveness of the treatment by 20%. Then we built a product, finished the product, we have paying customers already. We start having partnerships, established partnerships. I can highlight Deloitte, with whom we address the insurance market, and we have 2 pilots in preparation in 2 insurance companies, leading ones in Lisbon and London. And this is what we are going to do till the end of the year. We are finishing the round of negotiation with some investors to equip ourselves to get traction in Europe during the next 2 years, 2017, 2018, and then go to the United States full scale in the other stepping stone. And for that, we are asking the investors for 2 million euros to be ready to address all the market challenges in a, let's say, one-third allocation of funds in trial preparation, sales activities, and funding the baseline of the company. Thank you. I'm open to your questions.
Okay, thank you so much, Luís, and you made it a lot in time. So, do we have any questions over here?
So do you have, so first of all, is this class 2 or class 1 FDA?
This is not a medical device.
Okay.
This is a decision support system. We never replace or suggest any specific treatment. We just give more information for the clinician to take his medical decision.
And your client is the physical therapist, the doctor?
Well, in reality, with our solution, the same solution, but we can give 2 different value propositions. One specifically to the clinician, orthopedist, physiatrist, let's say clinical environment, or a claims manager in an insurance company. It's just the interface that is different because they see different results from the analytics. They want to see different things.
Okay, so you're quantifying physical therapy. Do you have, you've done 250 patients, do you have some kind of data on efficacy?
Sorry, I could not understand.
Some data on efficacy.
Yes, yes.
So they were cured with fewer sessions. They were diagnosed faster.
I understand. Now, in reality, we made 2 things in this proof of concept. We increased the effectiveness 20% because we were able to treat patients in fewer sessions and also secure that 1 year after there is less recurrency in coming back to treatment.
That's great. So this is something that you need to highlight in your pitch. That's probably the most important data for anybody who understands medical startups and devices is efficacy and readmittance. And in the US, as you probably well know, there's a big push now and the entire billing system is going to change around readmittance and efficacy.
Yep.
So that'll be your path to market. But I'm still curious how you're not at least a class 2 device if you're measuring anything that's medically related.
Well, one thing is that we never touch the patient. We don't interact directly with the patient. In reality, the system is not for the patient.
But you are a measuring device, in a way.
The measuring device is from a third party. We are on the software business, on the decision support system, but some clinics or hospitals don't have yet at least sensors to collect motor information. So in the first year, to reduce friction, we supply those. Okay.
So if you haven't already, and I'm guessing you have, but if there's a chance that you haven't yet gotten an opinion on this from FDA, I would highly recommend that you start that process ASAP.
Okay.
Thanks.
Point taken. Yep.
There's also issues around privacy of the data, right? Because you will be handling private records, so that requires HIPAA compliance and all of that.
Yes. Currently, the decision support system is located in Amazon Web Services because they are HIPAA compliant and also follow the EU regulations. In reality, we encrypted all the information. So in the interface that the clinician sees, he sees the name of the patient. And of course, if there is a claim and an insurance company involved, the claim manager also sees the patient. But for us, it's just a code. We never see it. It's encrypted. We don't store it in our database, the name of the patients.
So I have a tricky question for you. I see the value proposition for the patient. Get healed faster, don't come back. I see the value proposition for the insurance companies, they have to pay less. But the real driver for the implementation is the provider of the service, and there's no incentive for them.
No, there is.
It looks, I mean, you said it, that right now the system incentivizes or builds, I was trying to remember your sentence, builds
reimbursement, not
reimburses,
quality,
yeah, exactly. So for them, it's the same thing, right? So they want to have more sessions with the patient.
In the first moment, it's true what you are saying, but in reality, we learn from our interaction with customers, and we have already paying customers only in the clinical side because it's a bit faster than insurance companies that takes more time to implement things. The truth is that there are several dimensions where they would favor this kind of tool, of decision support system. If you are in a treatment session with an athlete, for instance, you need to secure that you treat him in the best way possible, as fast as possible. You need to go back to gaming or to training, whatever. Yeah. That's one thing. So they can open new services with something that they didn't have so far that could help them do so, instead of voodoo like we have discussed with so many football clubs, for instance, and then they continue to do this in a kind of voodoo way. That's one thing. Second, they want to have this tool. I mean, the fact that healthcare system is focused on reimbursement, it's because with the available tools, that's the way they found to put all the things running. But if we can give more centricity to the patient, to that particular individual, okay, this goes favoring the trend of medicine, I would say, and application. And on the other way, I guess that there is a sense of accomplishment in any professional that it treats the patient in a better way. They can open new services, they can increase their revenues, and also the insurance companies, if feel that there is a better practice in a certain health provider, will redirect more customers to them. So there is a kind of also referral, in the sense that if I have to redirect a customer, I know that the shoulder problem, that clinic treat them very well, or gait is another one, or knee, or whatever.
There's actually a shorter answer to that.
Yeah, I know, but you are the specialist.
Well, the short answer that you should actually really highlight upon is that with Obamacare in the US, they're switching billing reimbursement to medical practitioners to, they have for each code, they have a certain amount that they will pay as a flat fee, and the less time you spend on treating that patient, the more money you make. So that's changing very quickly.
Also, UK.
Yeah.
No, I don't have questions.
Good.
Okay, any further questions or comments?
A technical one. Why use a device and not imagine?
Sorry.
Why use the device?
Well,
Why not imaging?
No, it can be anything. We are agnostic to the way you collect motor information. The thing is, up to, let's say, 3 years from now, let's say, 3 years ago, till 3 years ago, this equipment was extremely expensive. So you could only find them in academia, in research labs, okay? Either cameras or sensors or whatever. But the prices went down, which enables us to pick these sensors, at least the sensors, the initial set, and bring them to the enterprise world, I'd say. And you need a sensor or a camera or whatever to collect high-definition data about what you are measuring, either cinematic or the strength or whatever. But we are agnostic. We are really in the decision support system business, let's say, in the SaaS business, not in what is required to collect. But because of the friction, we are supplying that. It's an entry level. I mean, if you need cameras and things very complex, but you have to buy them to the supplier.
Right.
Yeah.
What's proprietary in your decision model? Is it the
It's both, I'd say. So the real value, as you figured out already, it's on the data, of course. And as soon as this grows, more value there will be in the decision support system. But there are two important things that that gentleman over there invented, which is the musculoskeletal models that were designed to reconstruct the human movement. There is a huge value on that. And also, of course, on the machine learning algorithms, the way we look at the information and combine and distill all the information. In reality, niche players do parts of these in separate way. Then you need to integrate everything and to have specialists to act in electronic health records, movement software to collect motor information, big data analytics, etc. We combined everything in one offer. That's one of the...
What's the percentage of people that actually get injured in 2 different places in their body over the lifetime?
I give it to you.
Yeah, I'm just, it's a teasing question because if part of the value proposition is the integration between the providers, what I care as a patient is, will I get hurt on the knee and then on the shoulder, and I want both doctors to see the data and be able to decide based on that. Well, so I'm just asking how many people actually get hurt twice in 2 different places.
Well, it's...
I have, but
well,
I
yeah,
may be an outlier.
it's not the most prevalent, I would say. Or it's a traumatic situation, you have a car accident or whatever, or from a musculoskeletal or even neurological point of view, it's not the most prevalent situations. But that's why Luís also said that we have 3 stakeholders, 3 players here, the health providers, the insurance companies, and the patient themselves. And the third part we are not addressing at this stage, but they will come in also to deal with this platform. Okay? So, well, it's not the most common situation.
Maybe I gave you a wrong, or I mean, you interpreted my answer in the wrong way. What we integrate is the models, the big data, and everything. It's independent, what I say, from the dysfunction or from the patient, right? It's the ability to integrate all these multidimensional data about the patient, okay? So you can have one injury, and we have them all in the system.
So can I just add one thing? But if you are not lucky enough, and you have two dysfunctions, like a knee dysfunction and a shoulder dysfunction, but you go to the orthopedic doctor that works with that insurance company, he can be like a knee expert, but he probably is not a shoulder expert. But he will collect information, and because everything is centralized on a cloud, he can even ask a colleague or some other orthopedic doctor that works for the insurance company to revisit this data and and give his opinion. Okay?
How many models, dysfunctional models, do you have in your system at the moment?
Well, I can say that they cover all of the musculoskeletal dysfunctions, all of the anatomical joints, from ankle to shoulder to spine to even to cervical spine for whiplash analysis. So we have covered them all at this stage. Well, we have one full body model, but it's differently used. If you are addressing just the shoulder, we don't need to use all the joints because you have a computational problem in terms of time. So yeah, we have one full body musculoskeletal model that can be split in joints.
Thank you.
Okay, so no more questions for Luís. So that's it. Thank you so much, Kinetikos.